Welcome, everyone. It's a great honor for me to have my mentor, Professor Giuseppe Lanzino from Mayo Clinic, Rochester, as a presenter in this webinar today about the philosophy of life and success from the point of view of a neurosurgeon, which was organized by MEDEX, which is a medical community of Arabic-speaking medical students from 50 universities in Turkey. First, I would like to introduce Dr. Giuseppe Lanzino, who is a professor of neurosurgery and radiology at Mayo Clinic, Rochester in the United States. He is a valedictorian medical graduate from University of Bologna in Italy. And after graduation, he moved to the US to do his residency in University of Virginia at the Department of Neurosurgery. He did a couple of fellowships in open and endovascular neurosurgery at Buffalo and Barrow Neurological Institute. Dr. Lanzino is one of the world masters of neurosurgery, 750 publications on PubMed, considered as one of the most publishing neurosurgeons worldwide. Before leaving the microphone to Lanzino, I would like just briefly to talk about the reason of this webinar. I reached out to Lanzino, asked him to talk about his pathway, his success story from Italy to the United States. But his answer was no, because he has a different philosophy of life and success. And I'm not going to tell you about it. I'm just leaving the microphone to Dr. Lanzino to tell us about it. Before giving the microphone to Lanzino, I just want to tell you that there will be a question session in the end of the webinar. So prepare your questions and please go ahead, Dr. Lanzino.
Thank you, Amir. It's a pleasure for me to be here and just to share a few suggestions, and then we'll talk about some of my teachers, and then here and there I will share a few stories. This is a picture was taken when I was a resident in neurosurgery in Virginia. And this is one of my mentor, Dr. Loss, who had a profound impact on my personal and professional life. And as I was interviewing, trying to get a residence in Virginia, he told me, treat every patient like one of your family members. And that has been a guiding principle for me. I wish I could say that I was able to apply consistently every day throughout my 30 plus years professional life, but that's still what I think every morning before I come to work, before I see a patient. And that's important for a variety of reasons. First of all, everybody here on this webinar is here because we like to be the best we can, and we like to be our best. And by having this philosophy of treating every patient like one of your family members, automatically this principle makes you good, because you will feel a constant sense of responsibility, and that will keep you on your toes, and that will prevent a lot of mistakes, and that also will allow you to be more keen to listen to what patients and families have to say. And remember that even in this age of high technology, most of the times, if you know how to listen, and if you learn how to let people talk, the patient of the family will tell you what's going on. Now, when you start in a place, you know, the impact that the first impact, we like it or not, it's very, very important. And you really establish your reputation in the first few months when you start working somewhere. And especially as a resident, when more senior physicians rely on your assessment, be always honest and truthful in your answers. You know, when we look at residents, that's really one of the best and most important characteristics we look for. You know, the residents that tells us, I'm sorry, I don't know the answer to the question you ask us, say, what's the patient, they're calling you about a patient problem. You ask, what's the patient sodium? And the residents say, I'm sorry, I don't know, I will check, I will get with you right away, rather than somebody who starts making up excuses, or worse, starts making up numbers. This is Warren Buffett. Some of you might know him, some might not know him. He is one of the wealthiest people in the world, legendary investor. But it's really a man that has remained very simple and humble at the same time, and has a lot of really common sense and great advice. And this is one of his quotes: it takes 20 years to build a reputation and 5 minutes to ruin it. If you think about that, you will do things differently. That, of course, it applies to business like it applies to medicine and many other aspects in life. As a physician, as a doctor, and especially as a young as a medical student and then young resident, try as much as possible to check things yourself. If you get called in the middle of the night, a patient about a patient clinical status change, try to go and check things yourself. There is nothing more than nurses and the team, they like that a physician who is responsive and say, I'll be right there. They will respect you for being there with them on the line, rather than trying to make decisions over the phone because you are too lazy to get up and go and check, or because even though you might be busy, you don't try to make the effort. If you make the effort to be there, it will go a long way. And more importantly, it'll prevent a lot of mistakes, because you can gain the facts firsthand, and that you can make a lot of decisions. And always listen to the nurse and to the family members. Remember, those are the people that are there all the times, and they are going to be critical in allowing you as you make decisions, especially in patients who are hospitalized. If you order a test, check the result. There is nothing wrong nowadays, when we do surgery, we obtain a test as an MRI or a CAT scan the day of the procedure for stereotactic guidance purposes. There is nothing worse that you order an MRI, the patient who had the test 2-3 weeks before, and you go to the operating room without checking the stud, and then you find out the patient in the meanwhile might have developed some new findings. Also, if you order a test, make sure that the patient and their family are notified of the result as soon as the result is known. Remember, that's probably what you would do for one of your family members. You would not like for one of your family members who has cancer to wait 2 weeks from the doctor to get back with the results of a study that was ordered to follow up on the status of the cancer. It is inhumane to make people wondering about the results of a medical test for hours or worse days. Again, these are a lot of considerations that I think apply to medical students late in their training as you're doing your internships and residence, but it also applies to busy physicians as well. Write everything down. Don't rely on your brain to remember things. If you any task, make sure that you write it down. You send a reminder to yourself. When I started my internship in general surgery, the chief resident would ask me, say, "Where is your brain?" And his point is that my brain was not here in the head, but my brain was my pen that in those days you would carry around to write things down. And nowadays, I think all this can be done on a smartphone. Now, there is an art on how you talk to patients, because really that's where one of the magic of medicines is when you meet a patient and their families, you need to be one of the key features of a good physician is the ability to understand the people that you are facing. And again, I've learned a lot of this from my teachers, how to make patients understand complex things. And going back to Dr. Laws is the world experts on problems of the pituitary gland. And I remember that it would establish immediately a unique bond between the patient, their family, and the doctor, as he was explaining about the operation, and they would put up a sagittal MRI. And on the sagittal MRI, we tell the patient, you see, this is your pituitary gland. It's right in the middle of the entire brain. But don't worry, we can reach the pituitary gland. This is your nose, this is the back of the head, and we can reach your pituitary gland because we have a straight pathways going through your nose. And at the end of the operation, after the operation, you will feel a little bit of pain. It's just like somebody has scratched you in the back of the nose. And just giving the ability to a patient and their family to understand a complex disease and an MRI of the brain immediately would establish an incredible bond of trust between the patient, their family, and the doctor. Sometimes you can use humor, and it's funny, you will see like how much you are influenced by your teachers, the people you have trained. And remember, you learn from everybody. Common for a surgeon, a common question from patients and family: how long is the operation? And I remember when I was in training with one of my teachers, Dr. Spetzler, one of the best neurosurgeons in the world ever. And as he was concluding the visit, and the patient, the families, they were nervous about the surgery, they would ask, how long is the operation? The classic answer is say, well, until it's over. And that would invariably trigger a laugher in the room, and establish again a climate of trust, and at the same time of making a patient, their family, feeling at ease about the terrifying prospects of facing a brain operation the following day. Now, when you are faced many times during the day, especially when you are in a position of you are a junior trainee and you have to you are working under responsibility of more senior physicians or supervisors, you always face the question, when should I call? Should I inform my superior about this change, about these test results? And my philosophy, what I've learned over the years, has been that if you think about whether you should call or not, it's always better to call. When you are in a position where you are not the last one to make critical decisions, nothing wrong in going up the chain of command and informing people. And sometimes you might encounter disgruntled response, but there is nothing wrong if you think about, if you're not sure, nothing wrong in checking with somebody who has higher responsibility. Now, Amir had sent me some of the preliminary questions, and there were a lot of questions about how do you deal with the anxiety of the exams and everything. You need to realize that these are the best years of your life. So it's admirable to work and to work very hard toward the goal, but you also need to find a way to enjoy the process. When I was a medical student, I had a very dear friend. We were studying together that every day would say, I can't wait until this is over. I can't wait to start my residency. I cannot stand this anymore. Then he would start his residency. And they say, oh my God, I cannot wait until this is over. I can't wait to be a staff physician. I can't wait to be an attending. This is taking so long. And then guess what? He became an attending, and the same pattern. So the moral of the story is that these are the best year of your lives. It's a privilege to be a doctor. Never lose track of just think about yourself just a year ago, how little you knew compared to what you know today. And so never lose track of that process of all the positive things that you have going on. This is Dino Zoff. For those of you that are follow soccer or football, Zoff was the legendary goalkeeper of the Italian team who won the World Championship in 1982. And when he retired, he was 41. And they asked me, say, how do you feel? And he said, well, it's a bittersweet, it's a very hard training, a lot of sacrifices during these 20 plus years of my career, but I know that I will miss, and say, and they asked him after he retired, what do you miss the most? And he said, I miss the smell of the wet green grass during the training. So the moral of the story is that make sure that you appreciate all the little daily things, because you like it or not, when in 20 years from now, 30 years from now, when you look back, these are the best years of your life. So enjoy the process. And this is, when I finished my residency, I collected my books. This is my dear friend, Jeff Elias. We were together for many years of residency. So I am ready to leave Charlottesville and to go on to do my fellowship in Phoenix. So again, remember, these are the best years of your life. It's a wonderful journey. I wish I could go back and start all over again. I tell every day my dear friend Amir, I say, Amir, let's switch. I'm going to be a medical student in Turkey and you're going to be a professor. And Amir said, no way, I'm not going to switch. So he knows better. And this is in Clinic with another legendary figure in neurosurgery, Dr. Jane, during my training. And you see, like this was for the residents, was one of the worst and most tedious tasks, to go to clinic and see patients with the stuff. You have no idea how much I cherished those moments I spent with Dr. Jane in clinic, how much I miss it, and how much I wish I could go back and do it again. I don't know about other parts of the world, but unfortunately in the United States, we are facing in all different aspects of professional life, an issue with the burnout. To the point that if I'm in town, I am in the hospital even on Saturdays and Sundays. It's I can count on my both ends how many Sundays I missed it. If I was in town, I didn't go to the hospital. And invariably, when people see me in the hospital, you can see a look on their face. They kind of feel sorry, the natural reaction, they feel sorry about you, and they assume that you are on call. Well, I have news for you. I started school when I was 5. I got my first job at 37. So let me tell you one thing. Let me be in the hospital. Let me enjoy it. I worked really hard to get where I am. So I better enjoy being in the hospital, and being a doctor, whether or Saturday or Sundays, doesn't matter. So I told my residents, I said, do not feel bad for me when you see me here on a Saturday at 6 in the morning, even if I'm not on call. I told them this story that I started at 5, I finished at 37. I say, I hope next time you'll feel a sense of joy, because you realize that, I'm lucky enough that I'm doing what I worked really hard for many, many years to do. So do not lose track of how hard you work to get where you are, and enjoy any stage of the process. As far as if you talk to me, I'm now 57. I cannot get enough. And I also realize that the end is getting closer and closer. This is some of these considerations pertains more to trainees already in medical specialties. And nowadays this applies to neurosurgery, to some other specialties that are getting more and more complex. I always say, but the same applies to medical students. I mean, you might have made already your mind up. You like to do dermatology, you like to do ophthalmology, you like to do neurology. So it's important to develop a subspecialty interest. And this is particularly true if, as a resident, then you are interested in academic career. But remember that what you are doing now, this is the only chance you get to learn about everything. So make sure that you learn about everything, while if you have already decided on a specific field, that should be during medical school, during training, that field should be your hobby. That should be something that you study and you read about when you have some free time, because it's what you are truly interested. But this is the only chance you get to learn about everything. Read the textbooks. Again, it's amazing how a few simple words that one of your mentors or people you really admire might say here and there, and passage, and how they influence your life. This is another legendary figure in neurosurgery, Peter Giannetta, was chairman of the Department of Pittsburgh when I went from Italy to Pittsburgh in 1990 to do a research fellowship. And he would tell his residents, study 3 pages of a textbook each day. And after 30 years, I realized how critical that simple suggestion is. So why 3 pages? Well, 3 pages because it's a doable goal. It doesn't take more than half an hour of focus. And if you do that, 3 pages in a day, it allows you to study a textbook of 1,000 pages in a year. So it easily compounds day after day. It'll get you in the habit of taking some time during your day to continue the process of learning, which is intrinsic to medicine because the field is in constant evolution. And at the same time, it is critically important, and I can see that myself coming from Italy, where it was a lot of textbook studying from the textbook from A to Z, coming to United States, where it's a much more practical way of learning. You learn on the go. Of course, you take exams, and if you like to study a textbook, fine, but it's usually not a requirement. You are not tested on the textbook. And I realized that if you can combine the two, then nobody can beat you. So study the textbooks, study because the textbook will force you to look at the topic from A to Z, learn about everything. That this is your only chance, and it will serve you well as you move forward, no matter how specialized the field that you eventually will choose. Now, we all face setbacks in medicine, and that applies both to medical specialties, applies to surgical specialties, applies to radiology, to pathology, in the sense that you can misread something, you can miss something. And this is what I learned from one of my other mentors, Dr. Shaker. When you get into a problem, like in surgery, your patient is having a complication, is having something that you were not expecting, you better fight with your teeth. You don't give up. Over the years, I am from Italy. I'm Mediterranean. Most of the time I can conduct myself well, but when I see something I don't like, I tend to lose my temper. I tend to lose my composure. And I can tell you that after all these years, almost now 35 years between medical school and residency and practice, I cannot remember a single time where raising my voice or losing my composure, really, if I look back critical at it, I cannot remember a single time where it was conducive to anything positive. Now, life is not easy, and a lot of people, most people do have a good side, but then, the circumstances might make people behave in ways that are not ideal. And, no matter where you are, and particularly more so if you are in fields that are competitive, there are some people that stretch the rules. And you don't need to be a shark, but in life you need to be able, and you need to learn how to swim with the sharks. Or how Michael Dell, this is the owner and president of the company Dell Computers, put in this book, play nice but win. So you need to be able to like the magic is to be able to maintain your principles and good intentions in a world that it's not always, and often it's not not ideal. So make sure that you are you adhere to your principles, but at the same time you need to be ready to the fact that not everybody is going to play by the rules, and you need to be able to anticipate, to understand. But that does not mean that you need to compromise or you need to forget your values and play according to the shark rules. Now, the part that I had a bit trouble about the title of the presentation, as Amir was proposing, was about success, because how do you define success? It's not that I don't know. I think that success in life is to have inner happiness, to have a state, to be in a state of mind where you are content with yourself, with what you have, with what you have achieved. And again, I look at Warren Buffett, who says, I know so many people that have way more than they need, and many of them are not really happy because they have poor relationships with their families, particularly. And then I know a lot of people who have just basic means, what they need, just the minimum required to have a decent life, and then they are very happy because they have great relationships with their family. So, is again, Warren Buffett says, success is having people love you that you want to have love you. And this is another quote that I found. It has a lot of truth. Really, to be happy, you need the three things. Someone to love, basically relationships, family and friends, something to do, and of course, because you like humankind, we like to and we need to feel useful to society, to others. And of course, if you're lucky that you do something that you like, well, then it's even better. And then we all need, we cannot become complacent. We cannot say, oh, maybe stop. No, it's always, not always, but it's important to have, something to hope for. So if I could definitely, for happiness, success, you need good relationships, friends and family. Do something useful, and every job, every work, every one of us, no matter what we do, we have a way to make a positive impact to society, just by the way we conduct ourselves, just by the way we do what we do. And then it's always humankind, human beings, they do need hope. They do need something to aspire to. And I like to stress that if you think about this, if you think about these basics, then you can be happy no matter where you are. And I understand that circumstances might take us in different directions. Circumstances might be dramatically different across the world. But remember two things. We always tend to think that the grass of the neighbor is greener. And quite often there is, we cannot modify the circumstances we found ourselves into, because you never know where life takes us. But definitely we ourselves can affect the way we react to circumstances, no matter what they are. And that's the reason why you find people that are able to find a spiral, a little bit of hope, and they're able to find the positive spin in the setting of incredible adversity. This goes back to treat every patient as your family member. It was another doctor that I admire, Daniele Rigamonti, and he told me, he said, you know, if you want to remember every patient, no matter how many patients you see, remember every patient has a story, and you might not immediately remember the name, but if you talk to the patients, and then you'll remember, oh, this is Mr. So-and-so, he has a grocery store in Alabama. You know, you talk to people, you realize everybody has a story. And this is also something that I've heard from one of your countrymen, Professor Ugo Ture, who said, you know, I do one surgery a day. Every patient has a story, and I want to make sure that every day I give my best to that particular patient. Now, as I said, it's all about perspective, you know, like being a medical student, being a student on call in the hospital, or a junior resident on call in the hospital, and say, oh no, another night on call, you know, can be just routine, can be considered scat work. But if you consider all the emotions that you go through, and you consider the human aspects, you are on call, you have to go and tell the granddaughter of the lady who was at home, fell off a chair. Well, grandma unfortunately fell off a chair. She's not going to be the same. She's not going to be able to come back home. She said subdural hematoma. Or you have to go and comfort the mother of a young student who was going to a party, but on the way to the party, the car got in a car accident. So if you consider all these human aspects, all these emotions that you go through, and you don't let it become a routine, then I can tell you one thing. I've not been able to read any work of fiction, no matter how good it is, because it does not give me anywhere close the emotions and the swirl of human conditions I go through if I stop and think about the human aspects of the many people that I'm going to be meeting or I'm going to be interacting today. So it's all about perspective. Do not let become a routine. You learn everywhere. You learn from everybody in the world. And if you get the chance, travel, meaning always go and visit other places. I spent a year in England as a 6-year resident. This was our ICU. In the morning, it was like, oh, it's a good day. Let's open the window. So we changed the air. There were 6 patients in the same room in the ICU. Guess what? The results were pretty good. So you don't necessarily need sophisticated things to do good work. This is with Ernest Yem in Helsinki, and you know, the early 2000s he had created in Helsinki, Finland, in a small community hospital, an empire of neurosurgery. This is with the Professor Ture in Istanbul, visiting his lab, and then you know, there are a lot of nice interactions here. We were having dinner on the Bosphorus with another legend in neurosurgery, Evandro de Oliveira, arguing in Padova, Italy, about what's the best treatment for certain type of aneurysms. Now, no, I mean, not everything is, I mean, course, you deal with a lot of dreadful personal situations. People are sick. You live in the hospital, you get the impression everybody's sick. You know, still when I go on vacation and I see a lot of people around having fun, I say, oh, wow, it's for me almost a kind of surprise. Oh, not everybody is sick. And there is there are some legal aspects of what we do. I do, very risky procedures. So I can't, by the virtue of what I do, I cannot be constantly be worried about triggering a lawsuit. And there are some basic principles that are very helpful. Never force a patient or a family into a procedure that they do not want. You may think you know what is the correct thing to do, but at the end, if the patient life and it's the patient decision to go for it or not. And the other thing where I see that a lot of problems arise is that if a patient, but particularly family members, are concerned, patient is having headache after surgery, and you think most patients are having headache after brain surgery. So how do you know it's a problem? It's not a problem. You don't know just based on that. But sometimes if the patient, the family knows the patient. So if the patient, the families particularly, they are very concerned, never ever discount family concerns. Always try to address in a very courteous and kind way. And I am always surprised. I mean, I think I'm not superstitious, but every time I start getting a little bit flustered and frustrated, then I tend to be wrong. So I learn never get flustered, never get frustrated, and always listen and make sure that you can convey that you are sharing their concerns. Now, what does make a good doctor? Well, it's a combination of a lot of things, but again, it's when you decompose to the most simple elements, it's just common sense and judgment, the ability to make logical, rational decision and decide whether a given action is right or wrong. It's definitely the most, Amir, be careful because there might be somebody who is trying to occur. It's, judgment is definitely one of the most important aspects of a good physician. And these are some people that have had a profound influence in my ability to decide what to do. Dr. Cassell in Virginia, this is with Dr. Drake, who was his mentor. Legendary figures in neurosurgery. This is Dr. Jane with Dr. Drake. Ladislaw Steiner was one of the early adapters of gamma knife, incredible experience, incredible work ethic, and very charismatic and individual. And here is with Professor Dr. and Mrs. Yassergill at a dinner. This is Dr. Jane with Dr. Steiner. And I think it's important, especially if you are interested in innovation, you're interested in making a contribution. And remember, we all can make contributions in our specialty. You don't need to be in academics. It's important to know the history of the specialty you're in and the history of medicine. Here's with Dr. Laws, who is a culture of the history of medicine and neurosurgery. Here we're in England, and we went to visit Dr. Hosler's house in in Oxford. And surround yourself with positive people. I have a lot of trainees that come from Italy, and the first thing I tell them, I say, look, what you need to learn is that they are surprised at the end of the morning how much stuff we were able to pack in a morning. I say, look, the key here is that there is no point in spending time complaining. You create a negative energy. You just do it, and it's important to follow and surround yourself with positive people. This Dr. Loss, with one of his mentors, Dr. Levy. And this is another person who has had a profound influence on my life, Dr. Grant, a neurosurgeon who I met in Buffalo. Always looking, these people, they were always looking at the positive side of life, always looking at the positive side of a person. And again, I cannot say that I was able to this with Dr. Jane. As you can tell, he has had a profound influence on my life. I wish I could say I've been myself able to be constantly a positive influence on others. Unfortunately, I get quite often trapped in that tendency to, complain and to focus on the negatives. Be open to innovations. This is Dr. Hopkins from Buffalo, where I did my fellowship in endovascular. It was always constantly, his questions say, how can we do this better? Constantly. And as I said before, don't think you need to be in the Silicon Valley to innovate. Don't think you need to be in a major academic center. I challenge you to think that the most important innovation that came into medicine in the past 70 years, which is the ability to access, to use veins and arteries as routes to reach any part of the body, through endovascular techniques. That came from the intuition of a Swedish radiologist, Seldinger, who was working in a small community hospital in Sweden. And he realized, if you puncture an artery on the vein, then you insert a wire, then you remove the needle and you put a catheter over that wire, you can get access to any vessel in the brain, in the body. And that led to all the innovations in cardiac catheterizations, peripheral vascular interventions, endovascular neurosurgery, placement of central line, and so forth. So from a small community hospital, a very simple observation, dramatic influence on people around the world. And as I said, then you can still be able to be one of the greatest and get it all together. And this is Robert Spetzler. It's one of the best neurosurgeons ever. And he's really was a Renaissance man, and somebody with a very sensitive heart. And you can still perform at the top and still be a genuine and a wonderful human being. And then, as I said, you learn from everybody. And if I look back, you can tell I've had the luck of working and training under some of the best minds. But when I look back, I really, the basics and who I am today, it's probably more than any other place, any other people is related to this place. It's Ospedale Bellaria in Bologna. And these are Dr. Testa, Dr. Calbucci. These are some of my early mentors who really forged the way I am. So as I said, you learn from a lot of people in a different place in the world, and sometimes some of the best lessons come from unknown corners of the world. These are some of my early publications, just to say, I'm biased, but I thought that it's always, again, you don't need to be, don't need to choose an academic career, but it's very important, and I think it's very gratifying and also intellectually stimulating to develop some, niche interest, and everybody can make their contributions. And before I conclude, I like to, remind you that, time is the most precious commodity we have. We're never gonna get back the hour that we have spent, in this lecture. So this is, again, you go back, where do you learn? And this I learned from my grandmother, who always used to remind me, you will never get time back, use wisely. So don't waste time. Thank you very much. I look forward to answering some questions if I can. I hope this, is helpful in giving you an overview. I know that there are times where medical school can be stressful, residency can be stressful, medicine is definitely stressful. At the same time, I think if we keep in mind the basic principles, we can help ourselves, we can help others, and you can do that. The beauty of medicine is that you can do that anywhere in the world. I always say, people come to me and complain about the increasing administrative tasks, the threat of legal suits and friction and stuff. And I, always remind myself, look, there is somebody who is sick and needs help from an expert. I'm supposed to be the expert to help. And, nobody, I think, no AI machine can take away that basic relationship. So if you focus on that, you'll be fine.
Thank you so much, Dr. Lanzino, for this incredible presentation. Actually, before getting the questions from people, myself have two questions. So you mentioned as materials that we get out of temper. And this results in having bad issues with people around us we work with. So, but we need to know how you get rid of that, how you improve yourself, and also in case you had bad issues with people, you break up with many people because of that, stuff. So that's something we have. How did you make up with them later?
Well, I think it's like in surgery, and you need to, in surgery, I don't know, I never met a surgeon, no matter how skilled that person is, that is not, afraid that might not be the right word, is not worried about surgical, the exit, the result of a surgical procedure. So you need to learn how to tame your brain in a way, and teach your brain to that, that type of reaction is not going to be helpful. And when you feel that instinct that is coming, as much as possible, try to control. Again, don't get me wrong, I wish I would have done a much better job. And sometimes it's not easy, especially when I walk into a patient room and there is a situation that is not unexpected. I tend to immediately react. In terms of when you hurt somebody because of what you say or what I learned that there is nothing that goes further than a sincere personal apology, preferably done in person rather than on the phone or through a text or so forth.
Thank you so much. So anyone have any question? Please raise your hand.
Thank you, Dr. Giuseppe, for this webinar, and Dr. Lanzino for this inspiring talk. My question is that what was the hook for you, Dr. Lanzino, that attracted you into neurosurgery?
Well, like in life, you'll be surprised. I wish I could say was, I saw the brain, in life, you never know where life is going to take you. Definitely, I think it was a multifactorial. There was not a single event. In my hometown, there was a particular figure that was a neurosurgeon that was not from my hometown, that was working in a big academic center in Italy. And of course, just hearing about these legendary stories as a young person must have had some subconscious influence. And then it was the fact that during medical school, naively, I thought, well, I know everything about the liver, I know everything about the heart, but I don't know much about surgery. I've never been in a operating room. So I said, in Italy, you have to make, medical school is 6 years. Around the 4th year, you have to make a decision. So I said, gee, it would be nice to challenge myself and learn something new. And then really what pushed me to make that decision was that it was in the early days of the European communities where they were trying to encourage exchanges between different European centers. And I won a scholarship to spend some time in Holland. I was given a booklet, and on that booklet, I had to pick a research project. The one that seemed to be more intriguing was about cerebral ischemia, but I needed a letter from a neurosurgeon. So that was the end. So as I said, I always tell Amir, I said, look, Amir, I said, a year ago, you had no idea that we were going to be here talking about this. So I say, you never know where life is going to take you. So it's important to have goals. And it's also important to formulate a plan, but make sure that then that plan is very flexible, because you never know where life is going to take you.
Thank you, Lanzino. Mohammed Al-Aifi, please go ahead.
Hi, good morning, Dr. Lanzino. Thank you, Amir, also for moderating this very nice talk. Professor Lanzino, I just have a simple question for you. Well, in our contemporary times, given the very competitive nature of the specialty, at least I feel myself, that we are often pushed to our very maximum limits. And also during your talk, you said that it's important to, of course, enjoy our time. But in our contemporary times, I feel that the competition is so ferocious, especially if the ambitions are a little bit high. Is there a way to possibly balance between this kind of competition? Because I feel that it should be a combination of like near perfect grades and other additional stuff that we should, like extracurriculars to perform and so on. So I would like to ask you, is there an efficient possible way to keep a balance between such competition and our everyday life?
Yeah, I mean, I think there is an easy answer, is that, you know, if you want somebody to go into your brain, you know, you want that person not to be the best because of the competition, but because you want the person to try to be the best so that can do the best possible job. And I think the answer is you know, and that's common to any field. The people who are most successful are the ones that are passionate about, the ones that enjoy what they do. And then if you enjoy it, it's not, you're not pushed by the competition anymore, but you are pushed to the limits, but your pleasure and your willingness to get to know and learn more. And, you know, then, as I said, it's important to surround yourself with the positive people and people that understands and support. There is no question that there are a lot of choices, a lot of sacrifices that must be made along the way. But at the same time, you know, like it's the nature of what we do. I remember, you know, an anecdote when I just got married. I was in Charlottesville. It was Friday evening. And I had been on call in the hospital pretty much the entire day. And my wife was watching TV. I was on the floor with the book where I was studying brain anatomy, because the following day we were doing brain slices on a Saturday morning. And my wife said, "Hey, you know, can you take a minute just to enjoy a Friday evening?" And I turned around, I said, "Look, say somebody has to go into your brain. Do you want the person that is, you know, enjoying the minute, or want the person that is, you know, is studying and trying to get the best?" And that was a turning point in our relationship. Since then, she, you know, even more so, she has always been very supportive. But even more so, I don't have an answer. You know, this is my life. I have a family. I have 3 children. Amir has met some of them. I've been lucky because I've had a supportive family, supportive spouse. But you know, this issue of balance, I think it's taken a little bit to an extreme sometimes, where, you know, if I want to be cycling on the trails, you know, during the weekend, maybe I would have aspired to be a cyclist. You know, if I'm a doctor, there is nothing wrong. I'm in the hospital on weekends.
Thank you, Dr. Lanzino. Fuentes, please go ahead.
Sorry, good morning, everyone. Good morning, Dr. Lanzino, and thank you, Amir, for organizing this wonderful event. So I wanted to ask Dr. Lanzino, how do you manage yourself under pressure situations, maybe when there is a complication with the patient and the family is very concerned about the state of the patient, and maybe some of the directory board of the hospital is pressuring you? Could you tell us more about that? Thank you, Doctor.
Yeah, there is no question that dealing with the complication is one of the most difficult things we have to do. And, you know, like here, as I'm speaking, there is nothing worse than I fear than that state of mind of having done an operation and having done my best, but the patient is not waking up right. And then you are waiting, patient goes to CT and you are waiting for the result of that CT to show you, give you some ideas on what's going on. It's a very difficult question to answer because there are so many emotions, there are so many different reactions. You know, you say the administration is pressuring you. Well, that's definitely I don't think I've been in that situation, but that would not be my concern. My concern would be to number one, so when we deal with the complications, as I said, you train your brain not as much as possible not to let emotions overcome and influence your decisions. So the first thing is there anything I can do to reverse it, or anything I can do to change the outcome? Number two, I have colleagues that have not been involved. They don't know the family, so they are a little bit more emotionally detached. And if I need another opinion to see if there is anything I can do, I would, I rely on trusted colleagues that, they're not going to be enjoying about the fact that I'm having a problem, but they're going to be there trying to, as detached third parties, to give me some their opinion. And then how do you deal with it? Well, then again, you try as much as possible to rationalize. And the first thing is that, what could I have done different? That's what goes on through my mind. And you need to be brutally honest with yourself. I have I've seen over the years a lot of colleagues say, oh, it's the anesthesia, it was the resident, it was the medical student. You need to be brutally honest with yourself. And most of the time, I can identify something I could have done differently that maybe would have altered the outcome. So that's first you deal with it and fight to modify the outcome if you can. Second is the introspection. You look back and you say, what could have done differently? Because the worst thing is that we don't learn anything from that problem, and we're going to repeat the same outcome. So we owe to that patient, and we owe to the patient that are going to come afterwards. The most difficult thing is that by the time you're doing with the complication, there is another patient that in the meanwhile has come in and needs attention, and you need to compose yourself and be at your best. But that's that's part of what we do. I wish I could say, oh, I am the best one at dealing with this. I don't do great. Sometimes I had to cancel and stop the schedule for the rest of the day because I didn't feel I was in the best psychological condition to deal with additional issues. But and then Le Riche, the famous surgical French surgeon, said that every surgeon has a cemetery where periodically the visit, and there is no question that some of these memories they tend to haunt you for over time, the bad results that you have had. But that's also, I think, why you of course you can deal with that, and the more sensitive you are, the more you're likely to be affected and to suffer about that. But that's also part of life. And that's also why some people feel, okay, I don't think it's a good fit for me to be in such a field. Now, the same thing can happen. I see that, the same thing can happen in the medical field. It's just that the approach and the relationship with the problem, it's more indirect. And surgery is different because it's a direct thing. In a medical field, or it's something with pathology or radiology, you can still have complications by misinterpreting a finding, missing something, making the wrong decision, but it's a little bit more of an indirect effect. And I can see that colleagues in other fields, they might feel, they go through different emotions because it's not such a different, it's such a direct relationship between surgery and the outcome of that surgery. It's a very, sorry for the long question, from the long answer, you can tell it's, you touched a very, very sensitive and very difficult topic. I wish I could have an answer, but as I said, I think it's, first of all, you fight it, and if needed, you bring somebody in who is emotionally detached, that can have a 360-degree view to give an opinion if you have a trusted colleague. And then you learn from it and you make sure it doesn't happen again. And then you need to compose yourself and go on.
Thank you so much, Dr. Lanzino. There's a question from Hannah. She's asking how you can maximize the benefit of meeting a good mentor. She has also another question about how to prevent the work difficulties from intervening your productivity in work, especially in neurosurgery, which is a very demanding
sorry, Amir, the first question is about how you maximize your interaction with a good mentor.
Yeah.
Well, I mean, as I said, the key is that each one of us on this discussion has come across people that, for whatever reason, they are positive. They have charisma, and they have knowledge. They're wise. So you can choose your mentors, and then to maximize is that you need to understand that as you grow in your professional life, you learn and you know so much that it's very difficult to go back and put yourself in the shoes of the very young student or trainees. So it's important to, I remember, I can tell you most of the conversations I've had with my mentors over the years, because 30 years later, I still think about what I saw, what they said, and I still learn. So I think maybe that's a way to maximize the interaction, is to really, once you identify those positive people, those people that have something special in them, you really hang on every single word, and you in your mind, you think about, and as you grow professionally and as you grow in life, you understand more and more. It's a little bit like your parents, right? You understand your parents as you go through life, and even more so when you become a parent yourself. And the second question, Amir, there was another question.
I guess you replied that during the web presentation. She asked that how we can prevent the work difficulties to intervene our productivity in work, while especially in neurosurgery, which is a very demanding specialty.
Well, I think, I think that is everything you do. If you do it well, and if you are passionate enough, it's interesting, you can always improve. And again, I don't think that of course I don't think it's constantly a friction between maximizing your productivity and living a normal life. Each one of us has different different learning ways. I think one of the key, what I've learned, the people that can do a lot are people that maximize the use of time. So as I said, time is one of the most precious commodities we have. Do not waste. You see those people that are 15 minutes and they're working on a figure for a paper that they're working on. Other people, they go and get coffee. I am paralyzed. If I have patients that I have done surgery and I'm waiting for them to wake up, I can't do much, you know. So each one of us, you know, we have to adapt our own characteristics, but at the same time, there is a lot to be learned. You know, there are some people who can do so much, but they're also able to delegate a lot to other people. And some people do a lot, they might be able to do a lot, but because they are superficial in most aspects of what they do. So, you know, at the end, you have to make your own choice. It's not a constant fight. I make the choice that as much as possible, at the end of the day, I like to sleep in peace. And I made adjustments in my professional life to make sure that as much as possible, I could achieve that goal, even though sometimes that might have cost me some in terms of, you know, fame or achievements or so forth.
Thank you, Dr. Lanzino. So we have like 4 or 5 questions more. You want me to take them?
Yeah, go ahead.
Ahmed has asked that if you are in a situation that your colleague is doing a mistake or it doesn't make the right decision to the patient, would you act?
Well, you know, it's you know, the easy answer would be, oh, absolutely yes, yes. Yes. I would act, but I do also recognize that there are practical constraints due to a variety of reasons, variety of situations, which do not always, you know, allow you maybe to be as effective as your you know, you would like to be. But, you know, as a general rule, of course, if you see something that is not right, I think it's our duty to, you know, bring it. And, you know, now I'm in a position of seniority that, you know, I can, you know, if I see anything that could have been done differently, I feel comfortable addressing with the specific colleague. Of course, it's much more difficult, you know, at the beginning where you are in a position, but I think we all have the moral obligation as much as possible that if we see something wrong, to do what we can to, you know, modify that behavior.
Thank you. Thank you so much. Another question Ahmed has, I guess Hadi has asked that, if you go back to med school after doing all you've done, would you consider like something different you should take or look at in terms of like you think is the most important to be changed if you have a chance to go back to med school?
Oh, if I had the chance to go back to medical school, what I would have done differently? Well, I would have studied better. You know, we all get now, maybe it's easy to say with the, you know, afterwards, but we all get trapped with the issues of tests and scores. And I wish I had more time. I was not, and I'm still to this, I'm not an effective learner. In other words, is that, you know, I needed a full day to pack probably 2-3 hours of really, you know, real study. So I wish I would have learned and I would have been able to focus, and I would invest the time, but there was a lot of wastes during that day. So I wish I would, you know, what I used to tell my kids, power concentration. You sit at the desk, you're reading, you're studying the textbook, you just concentrate and you get the best of it. You know, we all have gone through the motions that we spend, you know, days on a textbook, and only the day before the exam, we are able to memorize almost the entire textbook because the mind is so focused, the adrenaline is running high. So that's what I would have done. And then as I go look back, I have regrets? Yeah, of course I do have some regrets. I would have been kinder in some situations to some of my co-workers. We all make mistakes. As I said, I would have, I was so focused on the process, so I was so focused on the goal that I didn't really enjoy as much as I should have. And now I look at those situations and I wish I had savored the moment a little bit more as I was going through the process.
Thank you so much. Amani, please unmute yourself.
Hello all. Good morning, Professor Lanzino. And thank you for this inspirational talk. It was really great to have you and to listen to you here. While we were talking about psychology and emotions, I have a question. As a fresh medical graduate, we are now in the stage where we are trying to decide on which specialty to pursue in the future. And, sometimes you're like, I'm afraid I will regret it. I'm afraid I will hate it in the future and so on. My question is, what is your advice for people who are thinking about a specialty and, but they are afraid that when time goes on and when time is moving, they will, like when they are residents there, they will hate it. They are afraid of that. Especially in surgery specialties. Thank you.
Well, as I said, it's everything done at the highest level, it's exciting. So I think one way is that once you make a decision, you appreciate the positives of that decision and you try to work on the negatives. Now, I think surgery to some extent, and each one of us has unique characteristics that might be fit for one field rather than the other. I want to be a soccer player, professional soccer player. I practiced, I watched all the games, I studied, I couldn't. Yeah, I could play for fun, but I didn't have what it took to be a professional soccer player. But that did not mean that I was not able to redirect what were certain characteristics and put it hopefully to good use in a completely different field. So my advice would be, don't choose based on what might appear glamorous, or choose based on what is your passion. Make sure that you fit as much as possible what are your individual characteristics. And then once you make the decision, it's not, you need to be flexible. I went into neurosurgery, and when I started doing neurosurgery, everybody was telling me about these incredible surgeries for basilar bifurcation aneurysm. So I said, that's what I want to do. I want to be able to clip a basilar bifurcation aneurysm. Finally, 5 years after medical school, I started my residency, and then endovascular techniques are coming by, and maybe that's the future. And so I became interested in endovascular techniques that were coming up at that time. And that, from a professional point of view, that choice really defined me, and having been one of the early neurosurgeons in the United States to make that choice has helped me immensely in my professional career. But guess what? I rarely got to clip a basilar bifurcation aneurysm because now they are treated with endovascular technique. So follow your passion. Fear, it's a perfectly normal emotion. Nobody can predict the future, especially in these days where AI is coming out. They're going to tell us everything is going to be done by robots. Make sure that the field you choose fulfills as much as possible what are your personal, individual, unique characteristics, then adapt as the conditions change. And, then in life, people call it luck, or you make your own opportunities. Be flexible, and, don't lose in medicine. As I said, don't lose track of that basic relationship. Somebody's in trouble, needs help. You are the experts there to help and to provide a solution to make that person better. And that relationship is going to be there no matter what. So that hopefully relieve some of the anxiety, but nobody knows where medicine is going to be 10 years from now.
Thank you so much, Dr. Lanzino. I just want to take the last question from Eduardo Agosti. I apologize for other people who couldn't reply the questions. Agosti, please go ahead, Eduardo.
Good morning, Prof. Lanzino. Here, Eduardo Agosti from Italy. Thank you for your presentation. I think that despite you are big in the world of neurosurgery, you are here with us today, providing us advice like a father, like a friend. So how to be better in this job that we love, neurosurgery, but also how to be better in life. I have only one additional question for you. I hope not too personal, which I think applies to many of those who are here in this webinar. Perhaps difficult to find a general answer. So you just mentioned this episode with your wife on the end of your wedding day, that you were studying anatomy for the surgery of the next day. So do you have one main rule to follow from your personal experience to find the good balance between hard daily work and family? Thank you.
No, I don't have. I don't have a good answer, and I don't think that there is a single answer. I think it's incumbent upon every one of us to find that balance and that answer. Keeping in mind that I think that, like especially in a relationship, it's important that there is mutual understanding, and that, sometimes it's not a either or choice. As I said, I was lucky because I found somebody who's been always very understanding and understood early on that it was important for her to have her own life, because to never depend on when and what time I was going to be home. And countless times we were ready to go somewhere. At the last minute, you see the pager goes off and plans change. So I think it's that I don't have a clear answer, but at the same time, I want to say that we are, we can make it a neurosurgery, a very demanding specialty, but we don't have to lose track of the fact that we are incredibly lucky and privileged to do what we do, and that there are many other people in the world who do not have the same luck and privilege to choose and to do what they like. And life, it's not easy, but I think it's way much easier for most neurosurgeons than for many other people around the world. So, let's not lose track of that.
Okay, thank you so much, Dr. Lanzino, for this incredible talk.
You're welcome.
Your attendance.
Hey, thank you, everybody. Bye.
Thank you so much. Have a good night. Day. Thank you all for joining. Have a good day.